But correct me if I'm wrong. I guess what you're doing is somewhat unique, and people need to know I'm not trying to side with you, but it is unique that how dental implants across the U.S. are typically done is you go to 3 places. You go to one doctor that does the surgery. You go to another doctor that puts the teeth on top, and then you get them maintained elsewhere. You do all 3 parts, all right there. And correct me if I'm wrong, you say you even print and make the teeth right there on site. Is that right? You do it all right there.
Yeah, exactly. You know, I started this process even before I was doing dental implants. You know, I used to do tons of dentures in-house, and I'm talking thousands of dentures. We had an in-house technician, you know, probably about 7-8 years ago. You know, and even back then when I was doing dentures, I found out you had to have a better way, and it was basically quality control, you know.
Because people just don't like their dentures.
Yeah, people don't like their dentures, you know, but you're asking how do we do it differently with implants, you know, and what's happened is, and this is before COVID happened, you know, you're going to one place, you're going to the next place, you're going to the next place. What happened now? It's supply chain, you know, so people understand this now.
It takes a long time.
It takes a long time, but not only that, it's the quality. Once you send it out one time, you send it out 2 times, you know, so you go in to see your normal dentist.
So people know what we're talking about. I want to make sure I know. So when you say send it out, typically dentists send their teeth out to get made elsewhere.
So,
and you do it right there.
Right. So you may see a normal dentist, and he's going to say, you know what, we work with a surgeon. They're going to go back and they're going to go to their notepad and they're going to write on their dental implants for Mrs. Jones. 3 months later, you're going to get into the oral surgeon. He's going to evaluate you for dental implants. Maybe he can do them, maybe he can't. Get you on a schedule.
Okay.
Get the implants done. Then you go back to your dentist, and then he's going to need your teeth to be made. Well, those get sent out again to another place. So when I created this implant center, I knew we had to have all the technology right there. To take it one step further, I don't even delegate this process out. So I start with obviously the patient, the consultation, I do the surgery, I design the teeth, and then I actually hand make every single one of my patient's teeth.